Sawasdee ka. Good afternoon, everyone. My name is Purisha Kulworasreth, and this is my study on deep learning-based osteoporosis screening, leveraging convolutional neural networks for hip X-ray analysis. So first, there are more than 8.9 million osteoporotic fractures a year. This means that one osteoporotic fracture occurs every 3 seconds, and it leads to adverse health outcomes such as chronic pain, deformity, acute complications, long-term disability, and increased mortality. Now, the outcomes for these patients after experiencing osteoporotic fractures are quite concerning, whereby only 20% make complete recovery. 50% has partial recovery, and a whopping 30% has a 1-year mortality rate. However, even though it's so prevalent, there are current diagnostic challenges to be met. First of all, osteoporosis is underdiagnosed. Most diagnoses are not made until fractures occur, and that's already too late. Secondly, there's a heavy reliance on dual energy X-ray absorptiometry, or DEXA scans, which are expensive and inaccessible, especially in rural areas. As such, this poses a need for an osteoporosis screening tool that is accessible, affordable, and accurate. Our proposed solution is this. We know that even in rural hospitals, simple plain radiographs are available. So why don't we take hip X-ray images, put them into a convolutional neural network model, have it analyze, and predict bone density values to determine the presence of osteoporosis. This leads to our objective to assess the effectiveness of convolutional neural networks, or CNNs, for osteoporosis screening using plain hip radiographs. This is our study's design. First, we implemented a training pipeline using TensorFlow, which is basically a software library for machine learning and AI. We coupled this with the exception architecture, which is known for its high performance in image classification. And this is our study design. First, we started with the dataset collection, whereby we collected our data from Chulabhorn Hospital from January 2022 to 2024. So we were able to acquire 287 hip X-ray images, whereby 188 was normal and 99 is osteoporosis. This was then split into training, validation, and test data sets. For the training data set, it was used for model training. Now, let's look further into this. So the model training, it analyzes the hip X-rays and determines whether it has osteoporosis or it's normal. So it was trained for 100 epochs with batch size 32. We used techniques such as a dam optimizer, categorical cross-entropy loss, dropout, and early stopping in order to prevent overfitting. We also used things such as image preprocessing and image augmentation in order to enhance our model robustness. So next, after the model training is done, we use the images from the validation data set to validate each epoch to make sure that it's accurate. The model with the highest validation accuracy was input into the system test. We took images from the test data set and used it for the system test, which produces an optimized convolutional neural network model. So these are the evaluation metrics used: accuracy, precision, recall, F1 score, and area under the receiver operating characteristic curve, or AUC ROC. So this is an example of the output of our model. You can see that there are heat maps highlighting the areas of interest for classification. So the red areas are regions considered significant, and blue are not as significant. These two are examples of normal. These are examples of osteoporosis, and this is misclassified. It's an example of our model error. You can see that the regions considered significant, some parts are not even localized on bone tissue in the lower part here. Yeah, however, overall, our model still proves that it's very accurate and efficient, with an accuracy of 94.44%, precision of 95.00%, recall of 94.44%, and an F1 score of 94.43%. This also has an AUC ROC of 0.944. So now let's compare it with other researches that are similar. So this research that I brought up as an example also uses convolutional neural networks for diagnosis of osteoporosis. However, the difference is that theirs uses spine CT images, while ours uses hip X-ray images. When we compare our results, it's very similar. But the thing is that hip X-ray images are less expensive and more accessible, which aligns with our objective to provide a low-cost and accessible osteoporosis screening tool for rural areas. So let's discuss the significance of this study. First off, in terms of policy, it would be a more accessible diagnostic method. It would reduce overcrowding medical care centers. Socially, it improves early diagnosis of osteoporosis and allows timely interventions such as lifestyle changes, pharmacologic treatments, and fall prevention strategies to be put into place. And economically, it will reduce the cost of hospitalization or surgery, which lowers the burden on both individuals and healthcare systems. Now, in the long term, this will shift from reactive to preventive medicine. What this means is that instead of waiting to treat the adverse health outcomes, we would prevent these osteoporotic fractures from occurring in the first place. So in conclusion, you can see that a convolutional neural network model shows a very promising potential in the screening of osteoporosis. Now here, we have developed a high-performance deep learning model. So in the future, we hope to incorporate larger data sets with varied demographics and incorporate multimodal data. And hopefully, we'll be able to scale the approach for deployment in rural clinics by making it have a user-friendly interface. So I would like to give an acknowledgement to Chulabhorn Academy, as well as my 3 advisors. And I'd like to end this presentation with a quote. Access to healthcare is not a privilege. It's a human right. So let's come together, make sure healthcare access is available to the whole population, and make this human right a reality. Thank you.
What an insightful presentation. Any questions for this presentation?
Thank you for your presentation. I do agree with you that this technology could be accessed to from other people outside. My question is that your osteoporosis and non-osteoporosis data set, how and I mean, do you have any information of these people so we can understand that how we would apply this to the whole general population? For example, like the age group, the disease or something that which the data that you get from both osteoporosis and non-osteoporosis patients.
So this is a preliminary research trial, but the inclusion criteria used was both females and males aged 50s or over. They should have hip x-rays of both sides of their hips, and they should also have already had DEXA scans. So that's why we were able to also have our machine predict the BMD and then evaluate whether they have osteoporosis or not. And the exclusion would be like people with like deformities or metabolic diseases and trauma.
Like the information of the population that you included in your study, for example, the average age and the underlying diseases, I would like to understand more.
We underlying disease and average age. Well, we didn't actually include that into our data yet, but it's because this is only produced as a screening device, and like the current trend in Thailand is that we're moving into the super age population. Right now, we're in the aging population, and so it's just a screening device to screen people with ages like 60 or over, or even 50 or over, in order to see whether they should receive pharmacologic treatments or lifestyle changes prior to experiencing osteoporotic fractures.
Okay. You don't have the information of the patients?
No, I do not.
Okay, thank you.
So excellent presentation. We also have osteopenia. Suggest for maybe in the future, maybe if you corroborate what Ajahn said about their clinical data, just not like very detailed, but just the one that relevant, and then maybe only add osteopenia as well, because we can find in DEXA scan it might actually improve the outcome, and then actually can have like better recommendation for what to do next as well. Okay. Thank you.
In current, for the osteoporosis screening, it have the clinical risk score to use. And then I think your work is interest because it's to apply the X-ray for the screening purpose. But in the purpose, for the X-ray is the higher dose of the radiation more than the DEXA. And the DEXA is the, until now, the DEXA is the diagnostics testing for the osteoporosis. If you use of the X-ray and use for the X-ray for the screening, I think is not appropriate now. But if the patient have the X-ray of the hip and then you use of the technique for apply for the previous X-ray and then to screening the patient, they have a risk or not risk for the osteoporosis and further to do the DEXA in the next, I think is agree. Okay?
Thank you ขอบคุณค่ะ